Welcome everyone to our coffee break. I've just started something new and I wanted to do this thing with my bestest friend in the whole wide world, Dr. Tara. And so every week we're going to just be having this get together and just chat about whatever we want, really. So, Dr. Tara, wasn't it so cool that how we just met and connected with the essential oils? I don't even remember it. Let's see. It was about 2012.
Yeah.
Yeah, I don't remember if it was you that reached out to me or I reached out to you, but whatever it was, I sent you some essential oils to help you because at that time you were in school learning about how to be a chiropractor, and here you are. You have your own
Yes.
business, so that's so exciting. So,
Yeah.
go ahead and explain like what you were going through during that time and reached out to me for the essential oils.
Okay. Yes. So during that time, I was in a little over a year into chiropractic school, and granted, very stressful time. And I started having problems with my hair falling out, and I knew I was under a lot of stress, and I was taking lots of vitamins and supplements to help with stress. But I went and got my thyroid checked, and they basically were like, "Oh, you're fine." And I was like, no, my hair is literally falling out. If I touch it, it breaks and falls out. So I'm like, no, something seriously is wrong. And so I had remembered you had reached out to me and told me that you were using essential oils. So I just happened to be like, hey, do you have anything that could help with this? And so I think you sent me rosemary, which is my favorite. And you sent me some balance and some elevation, which are two that are blends that are really great to help balance out hormones. And so as soon as I got them, I started using them, and literally, I just took the rosemary and I just put it on my scalp. And after I'd wash it, and I just gently put it in there on all the places that were starting to become more bald. And I was just like, oh my gosh. And I'd put it on there a couple times a day, and I could immediately feel that I felt like, whoa, there's something with this. Like I'm feeling better. And then I used the balance and elevation throughout the day. And those were my oils I carried with me all day long. And I could tell that they were like really helping me with my stress level and so forth. And sorry, TikTok's in the back.
Molly is not having it. She's like, no. Mom, someone's here.
Oh my gosh.
Tell them to be quiet, Mom.
Yeah, right? So so with that, I basically started using balance and elevation, and I could just tell like it was really calming me, and it started making me feel really better, and I could handle the stress. And so then I just started I'd apply it throughout the day, and I'd start feeling better. And it was amazing. So then I noticed about maybe day 2 or day 3, I started noticing that my hair was actually growing back, and my whole texture of my hair changed and everything. And I was like, oh, okay, like there's something to this. And so that basically is what started me, and I was in love with the oils and have been in love with them ever since. So I use them every day in the office on people and on myself and on my pets and everything. So
yeah. And the best part, it reconnected us, and we have this amazing relationship. So I love that about the oils is the reconnection of relationships. Yes, okay, so definitely. How long have you been doing chiropractic?
So let's see. It's been 8 years. Oh my goodness. It's been 8 years. I of course, started later in life when I went back to school, but it was a God thing, and God told me, like, you go to school, I'll get you through it. And so, because at that time, my history is that I had a traumatic brain injury. way back right after I graduated from high school, and it literally left me with double vision, loss of speech, and lots of memories and everything. And so I had to relearn how to do basic functioning. And the traditional medicine model was not offering any help. They just basically told me, you know, your you have a brain injury, it's going to heal in 3 to 5 years, or you'll just be left with what's ever left. And I was like, that's not okay with me. So through chiropractic, it really helped. But I did notice that different styles of chiropractic, some would hurt me more. And so I knew that there was really something with my neck, and I had to be very careful with how I was adjusted. Because a lot of times, if I turned my head to the left, I would literally get double vision and almost pass out. So I knew that there was something seriously wrong with my neck. And so I actually ended up, after I finished my bachelor's degree, I ended up going to work for a chiropractor, which was a God thing too. He just was like, you need to go work here. And I didn't understand why at the point, but I was like, okay, this is great. And I learned so much. And then it was like one day, someone just told me, one of my patients was like the way he said it to me is like, no, you need to go to school. Like, this is what you're supposed to be doing. And I was like, oh, okay. And so I was like, okay, God, if I'm supposed to go do this, because it was really hard to study and even finish my bachelor's degree took me a long time. And so, but I did. I followed God and followed what he told me. And I'm so thankful that I did, because it's been my passion is to help other people with traumatic brain injuries and give them their life back, because your body can heal. And as long as you can get it unlocked and allow your brain to start healing, you will, you get your life back and your body heals, and you can get a lot of function back into your life. So
yeah, and you brought up a good point of the different techniques. Can you go over a little bit about what kind of technique you do there at the office in Wasilla?
Yeah, so it was when I went to school. Well, granted, before school, I knew if someone like twisted my neck and adjusted me that way, I knew like that really didn't help me very much. A lot of times I would like go in with neck pain, and then they'd adjust my neck like that, and then I'd walk out and I'd have like sciatic pain going down my leg, and I was like, I didn't have that before. So I'm like, where did that come from? And I didn't understand at the time. But so when I went to school, one of my great interns learned this technique, and he's like, with your history, I think this would be great. And he's like, can I try it on you? And I was like, sure, let's do it. Because I wanted to go and I wanted to learn every technique I could, because I'm like, God, you're going to show me what technique or techniques basically that I need to use in order to be, successful and help heal people. And so he did it on me, and it's really nice. There's no twisting, turning of the neck. It is very gentle. But what it does is, most of us are caught right here, the very top vertebra, which is our C1, and it gets locked up. And when it gets locked up, it puts all this pressure on your brainstem. So you don't have full functioning of your nerve flow and blood flow going from your brain down to the rest of your body. And in turn, it's like having a noose around your neck, but your body is still trying to function, which it amazingly can. But, then we're all like, compensating, and our body's all, off, and, and people don't realize until somebody shows them like, wow, your head's really tilted and it's rotated, but you feel normal, or not necessarily normal, but just you feel like you're okay. But that's what I specialize in, is just unlocking that. And it's a very gentle, like hardly any pressure. I mean, just a little whoop, and that's it. And it basically unlocks it to where all of your muscles get to relax. And And then I use a little activator, which is very gentle as well. And just, a lot of times the whole lower body relaxes after you get your neck adjusted. And so then I just have to do a couple of things, maybe some shoulders or something to make sure that they're all free and clear. Because we like to save people from having major surgeries. So knees, shoulders, ankles, all that kind of stuff. We adjust to help make sure that they stay in perfect alignment.
That's great. Okay, so you have a business in the Valley, Wasilla, Alaska.
Yes.
And it's an integrative office versus a chiropractic office. So tell us a little bit of why you went that route.
Okay, so I've always, in the back of my head, thought about an integrative office would be really cool. You have, medical and chiropractic and, even PT and, have everything under one roof for people. And it wasn't until 2019 I came across this really cool therapy that I wanted to do. It really helps people who have any numbness or neuropathy in their body. It helps to regenerate the nerves, and it's a new technology out. And because I myself, from my accident, had some nerve damage in my lower legs, and when I tried this therapy, it was like, oh, this is totally amazing. Took a lot of the pain away and just regenerated those nerves to where I'm back fully functioning again. And so, but with that, we had to have a medical professional, because there was a certain part of it that they do injections. And so I basically, I was like, okay, we're going to have to go integrated. Let's do this. And so granted, it was in 2020. So that was a challenge at the beginning. But we, pushed right on through and had a lot of our own current patients that went through the program first and just raves about how it totally changed their life, gave them their life back. They can walk again and they don't stumble or fall or be in pain. They can actually feel their feet again. The skin on their feet looks nice and pretty again. So yeah, it's been a great thing. And then ever since then, we kind of added physical therapy. We have some really cool techniques that we do. We do exercise with oxygen therapy, which is very healing for your body. And it's a short 15-minute. So it's great for people who have a lot of deficits in their body, but it's also really good for that athlete who wants to push forward and build up their endurance and be stronger. So it's a great team of people that we have here. We have massage as well. And we've grown to where we have actually 3 chiropractors now. 3 full-time chiropractors. Yeah. So yeah, it's been really great, and we've been just working hard, and we have a great team here. So any of our patients can get any medical services they need, even if it's urgent care, and also get the whole rest of it so that they can be totally healed. So
love that. So glad you guys are in the Valley.
Yes.
Okay, so let's add in a little bit of essential oils. This month is the dōTERRA is offering free frankincense.
Ooh, my favorite.
Orders, I know.
Yes.
So tell us, a little bit about frankincense. How do you like to use frankincense?
So frankincense was one of my first oils that I got, because once I realized the benefits of frankincense, especially with traumatic brain injuries, I was like, even though I was a broke college student, I was like, I got to figure out how I'm going to get this, and I believe my first bottle was in December with the order, because that was my free one. And I was so excited. So got frankincense. Frankincense is great for people with brain injuries. You can put it along your hairline here, or you put it right back on the back of your neck, right there in that little divot little area, because that's right where you can feel has more access right to your brainstem and so forth. I sometimes will put it behind my ears, but I really do like just putting a drop under my tongue, because that gets right up into your brain and can start working. But it really is the king of all oils, and you can use it for so many different things. But frankincense is very healing. It's also been proven with different research studies that it's really good for any sorts of growths in your body. If anyone has any like cystic growth or tumor growths, that you can start putting that on that, taking it internally, and that it helps to like shrink them down. I've had some patients that actually used it with a form of cancer, and they had amazing results. I mean, even though they had to go in and have surgery, when they went in to have surgery, from the initial scan, the area had shrunk so much that they were like, there's hardly anything that we have to do. And so they were like, whatever you're doing, keep doing it. Like, it's really been beneficial. So that was really encouraging. So I love frankincense. Plus it's one of the oils of the Bible. So, thinking about, the benefit that God gave us with frankincense, it's just amazing. And it can heal in so many different ways. So, I'm always what's your favorite way of using frankincense?
Well, I was just going to mention, like, it was even more valuable than gold, right? Frankincense. And like, they're still finding frankincense in tombs, and the quality of the frankincense is just as good as it, it's like not compromised at all. So I love to use frankincense as a pick-me-up, frankincense and peppermint together during the afternoon when you're feeling, tired and all that.
Right?
Frankincense and peppermint in the palm of your hand, and then inhale that as a pick-me-up. So that was really good. And plus for anti-aging.
Yes. I love using it for that. Yes. For sure.
And for head tension, frankincense is a great one for head tension. So
yes, definitely.
Yes.
Sorry.
So anyways, that's just a little bit about Dr. Tara and her wonderful business in Wasilla, Alaska. So I will make sure to link all the information for her office in the description below. So make sure to check that out. Go check out her business if you live locally in the area. She's wonderful. She has healing hands. I love just going to the office, just soaking in everything I can get.
Right?
She has massage chairs.
And you can even come and meet Molly.
Oh,
this is little Molly in our office. She's
she's a therapy dog.
Therapy dog to help greet everyone.
Yeah, exactly. Yeah. So and so each week we're going to talk about a different subject. We're not really sure what we're going to talk about. It'll be fun for sure.
Yeah, but if anybody has any comments, just put comments down below. If there's any topic that you want us to go over, we'd be happy to go over it.
Exactly.
Yeah.
All right. Well, thanks for tuning in. Take care.
Thanks. Bye.